Well, good morning, everyone. I think we are about ready to start. For those retirees that join a little late, I'm sure we'll be able to recap for everyone. I want to thank everyone for joining today's Zoom call to go over the Anthem Medicare Advantage program that's being offered to the Milford Board of Education. My name is Kim Parker, and I'm from Anthem. And my goal for today's meeting is to really go over the program, address all of the questions that you have, and make you feel much more comfortable at the end of the presentation once you have the opportunity to hear all of the information and get your questions asked. I do want to address a couple things up front. We will be using the chat feature to address questions. So if something comes up, just type it in the chat and I'll be more than happy to answer all of those questions. I just want to address a couple of items up front in regards to some, I guess, information that you may have heard through talking to some of your fellow retirees. First and foremost, I want to let you know that the process for the premium payments is going to stay the same in regards to Milford paying the premiums directly to Anthem. So there's no need to file for reimbursement or pay those premiums in full. Everything goes through Milford Board of Education. So that process is not changing. Another component that's not changing is your Part B reimbursements. So you're entitled to your Part B reimbursement. That process will not change. So you'll continue to get your Part B reimbursements from the Board of Ed. I also want to touch upon the dental benefits for those retirees that do have dental coverage. That is a separate benefit that is not impacted by this change in any way. So your dental benefits, if you do have those, will remain intact. This program is for the medical and prescription drug portion of the benefits that are offered through Milford Board of Ed. And I will say for those retirees or spouses that are paying a portion of the premium or have a contribution, there will be a significant reduction in the contribution portion for the new plan that will be rolling out for January 1st. Okay, I'm having trouble moving. There we go. Okay, so for today's discussion, we're going to go over a few things. We're going to go over some basics, really talking about what Medicare Advantage is all about and how it works and how it differs from what you have today. We'll specifically go through the medical benefits and the prescription drug benefits. We'll talk about some of the enhancements to the program and how the program helps members and retirees stay healthy. We'll go through the enrollment process, and then obviously we'll be addressing any questions that you have. I'm just going to check quickly to see if there are specific questions that came into the chat. Okay. All right, some of these I will address. Okay. First, I want to start off with the First Impressions support line that's open for retirees. So if anything is not addressed during today's meeting, or you have a very specific personal question that you need to ask an Anthem representative, or you want to have them look up a provider for you to see if they're in the network, you can do that by contacting the First Impressions line, which is the 833-848-8729 number. This was included in the initial letter that you received from the Board of Education, and is also included in your pre-enrollment guide that you received from Anthem. All retirees probably received it either yesterday. If you have not received it in the mail yet, it should be coming either today or tomorrow. The timing was pretty tight in regards to getting the enrollment guides out. So everyone will have the enrollment guide, and it will have a full description of the benefit plan that's being offered to the Board of Education. I did want to mention that many retirees received a flyer from Anthem talking about a new identification card. That's for the current program that you are under. So you can ignore that flyer for right now because the program is going to change to the Medicare Advantage program. So please don't get, I guess, confused by the duplicate mailings that you're receiving. The flyer was for enrollment ID cards under the current plan, which will not be coming because of the changeover. To go through an explanation of how Medicare Advantage works, basically a Medicare Advantage program combines all of your original Medicare Parts A and Part B benefits. Part A is your hospital benefit under traditional Medicare, and Part B is your medical or provider coverage under traditional Medicare. And then you also have your supplemental program through the Board of Ed, may it be the Supplemental Plan F or the Major Medical and the High Option program. We're combining all of those pieces along with your prescription drug benefit into one program. So the Medicare Advantage plan combines everything into one benefit package. Anthem becomes your primary, secondary, and prescription drug coverage all rolled into one. So under the new program will cover all of your Medicare Part A services, Part B medical services, and your prescription drug benefits under the Part D portion of the plan. Now, in addition to all of your Medicare covered services and supplemental services, there are additional benefits that are now included in the Medicare Advantage program. Some of those additional benefits are hearing aid coverage, eyeglass reimbursement, healthy meals, pantry benefit, silver sneakers, routine wellness visits, your annual physical. All of these services are covered under the program, and they're covered under one identification card. So when you see providers or go to the hospital or fill your prescriptions, you'll have all services covered under the one single identification card. And you'll have access to a national network, as well as the ability to see providers that are outside of our network and still have the same cost share. Under a Medicare Advantage program, it's not simply a payer of claims, it's a healthcare delivery system for retirees. So under this program, we have processes in place to help retirees navigate the healthcare system and help you engage in regards to preventive care, wellness care, and also making sure that you have a care manager or a caseworker help you navigate when you have complex health conditions. Under a Medicare Advantage program, you'll see better health outcomes. And the reason why you'll see better health outcomes is because you have clinical professionals that are helping you navigate the healthcare system and helping you manage your chronic conditions better. And we see tangible results in improved health outcomes for members. On this slide, you'll see there's 41% fewer acute care hospital admissions because we're helping members manage those chronic conditions. And then you also see a tremendous increase in preventive care and wellness screenings under a Medicare Advantage program. In comparison to what you have today versus a Medicare Advantage program, we put together a program for Milford Board of Ed that mirrors your cost share. So in regards to the plan experience, when you see a doctor today, Medicare pays their portion, and then the supplemental plan pays the balance. So the member has a zero cost or out of pocket for medical and hospital services. We mirrored that experience under a Medicare Advantage program. So your cost shares under this plan will remain the same at a zero cost share. So when you see your primary care doctor or a specialist, the cost for those services would be a zero copay. So there will be no out-of-pocket costs for your medical services. We've also incorporated clinical and wellness programs. Under traditional Medicare, Medicare does not cover your full head-to-toe annual physical. They only cover their routine, their well exam, which is a very limited exam when you go to see the doctor. Under the new program, you'll have benefits for full physical, and all of the appropriate tests that you need to take for your annual physical. That includes the health screenings and tests. I touched upon the value-added benefits, the silver sneakers and the hearing aid, some routine podiatry services, and more. In comparison to the supplemental plan that you have today, it's far more robust in regards to covering additional services. But I do want to emphasize the fact that under a Medicare Advantage program, we are contracted with the federal government, so we are required to cover every service that traditional Medicare covers. So we cover all services that are covered under traditional Medicare, and we follow Medicare's clinical guidelines in regards to coverage. So if it's a covered service under Medicare, it needs to be a covered service under the Medicare Advantage program. Before I get into the doctors, I just want to check a few questions quickly. I will be talking about the out-of-pocket, the troop under the prescription program. So I will be touching upon that when we get to the prescription drug portion of it. Okay. All right, let's continue on to the provider section. Under the program with Anthem, you'll have access to over 600,000 participating providers that participate in the National Blue Cross Blue Shield network. So this product is portable. You can reside in any state in the United States or a US territory. The network is incredibly vast. As I said, it's over 600,000 providers that is in the National Blue Cross Blue Shield network. But I want to emphasize the fact that you're not bound to the network of providers. So if you're seeing a provider that doesn't happen to participate in the Blue Cross Blue Shield network, you will still be able to see that provider as long as they participate and are recognized by Medicare. So this program does have in-network and out-of-network benefits. So regardless of your provider's participation status in the Blue Cross Blue Shield network, you'll still be able to access services with that Medicare provider, and that Medicare provider will simply bill the Anthem Blue Cross Blue Shield plan, and we will pay them as we would pay them, as they would be paid under a traditional Medicare, the Medicare allowable rate, and your cost share would still be zero. I just touched upon this. So the plan does have two types of providers: your in-network provider, which is a Blue Cross Blue Shield provider participating in our network. And then you also have access to out-of-network providers. Those are providers that are not in our network, but participate in Medicare. And you do have the freedom to see any provider that does participate in Medicare, regardless of their participation status in our program. The program does not require referrals, so you do not need to get a referral from your primary care doctor to see a specialist. You have the freedom to see specialists when you need to see a specialist. Prior authorizations, this is a question that has come up in every presentation that I've done. Is we address, there's no referrals needed, but there are certain services under the Medicare Advantage program that may require prior authorization. The prior authorization process is handled directly from the provider. So this is not something that you as the member need to do. The providers handle all of this behind the scenes on your behalf. Most services that require prior authorization are your inpatient hospital stays and surgeries, your complex diagnostic tests like a CAT scan or an MRI, some physical therapies and speech therapy and occupational therapy. Those are some types of examples of services that may require a prior authorization. Now, how it differs from what happens today is Medicare has a retrospective review. So they don't require prior authorization up front, but they do review retrospectively after a claim comes in. So there could be a potential under traditional Medicare where a retiree may have had a service done that Medicare can come back and deny. And an example of that, you might see that is in a scenario where a member is not in a hospital for a 3-day hospital confinement prior to going to a skilled nursing facility or a rehab facility. That would not meet Medicare guidelines. Medicare could turn around and deny that claim. So the pre-authorization under a Medicare Advantage is done on the front end. Under traditional Medicare, it's done on the back end after a claim has been submitted and it could be denied. Out-of-network providers are not required to seek prior authorization prior to the service. What we do is we retrospectively look at those claims as well, similar to how traditional Medicare does. But once again, I wanted to emphasize that this process is handled by the providers, and it's not something that the members will have to do. We also have our Live Health Online benefit included in the program, and this is virtual doctor visits. So in the world of COVID, many of your providers are doing, I guess, virtual visits with you, but not all providers are set up to do virtual online doctor visits. So we also have the Live Health Online benefit, and this is access to providers 24 hours a day, 7 days a week. You can access the Live Health Online app on your computer or your smartphone or your iPad. And this will give you access to a board certified physician, and you could have a virtual doctor visit directly over your, as I said, smartphone or computer. So you'll have access to Live Health Online in addition to all of the benefits that you have under the program. As I said earlier, the program is going to combine all of your benefits under one program. So the Anthem Medicare Advantage plan covers everything in one. So it covers your doctors, your hospitals, and your prescription drug benefit, in addition to all of the additional services that are included in the program. This is a high-level overview of just some of the benefits that are included in your program. As I mentioned earlier, everyone should have received a pre-enrollment guide from Anthem that has a lengthy benefit summary included in that enrollment guide that outlines each and every benefit in much more detail. But just to give you a snapshot, I want to let everyone know that the plan does not have a deductible. So it is a zero deductible plan. You do not have to worry about that Part B deductible. There is no deductible under the Medicare Advantage program. It is zero. Your physician's visits, whether they're your primary care visits or your specialty visits, are covered at a zero copay. And that's whether it's an in-network or out-of-network provider. So the cost share is zero under the program. For your hospital benefits as well, it's a zero copay, and emergency is zero, and all preventive care. So basically all services under the Medicare Advantage program are covered at a zero cost share to the member. And the maximum out of pocket for the plan is zero. So all services are covered 100% with a zero cost share to the member for your medical and hospital benefits. The prescription benefits work slightly different, and I will go through those as well. The pharmacy benefit. The pharmacy benefit is set up to mirror what you have in place with the Blue Scripts plan. However, there's some enhancements to the program. Under the prescription drug program, you'll have a zero copay for what we call select generic drugs. And this slide shows a sample of some of those select generic drugs that are eligible for the zero copay. So select generics is a zero copay, and that's zero copay whether you get them at the retail pharmacy or if you get them through the mail order vendor. Your generic tier 1 generic drugs, you would have a $10 copayment for those generic drugs. Preferred brand name drugs would be covered at a $25 copayment. And then non-preferred brand name drugs are covered at a $40 copayment. Now, those copayments are for your retail 30-day supply. If you get a 90-day supply of prescription drugs, either through the retail pharmacy or through mail order, you'll be able to get the 90-day supply of prescription drugs for 2 copayments. So for example, your generic drugs, you would get a 90-day supply for a $20 copayment. Now, how this differs from the Blue Script plan that you have in place today is there is a $10 generic copayment and then a $25 preferred brand name copayment. The Blue Script plan does not provide coverage for non-formulary drugs. So this program will now include a tier for those drugs. So under the current Blue Script plan, you would not have coverage for that tier 3 non-preferred brand name benefit. So it is enhancement to the current program that you have in place today. To get your prescriptions, you can fill them at your local retail pharmacy, which we have over 68,000 pharmacies that do participate in the network. Or you can choose to fill your prescriptions through the mail order vendor. So you can get your 90-day supply for your maintenance drugs through the mail order. And when you receive your welcome kit and all of your identification card and new materials, it will include in that welcome kit information on how you can get yourself set up with the mail order vendor if you choose to use mail order for your maintenance drugs. As I mentioned, you'll receive your post-enrollment materials that will include detailed information on how you would set yourself up with mail order. It will have a form and you would simply send that back to the mail order vendor with your prescriptions to get you set up with the mail order delivery, which would be automatic. So once you get set up with mail order, you'll automatically be put on a refill schedule. So you don't have to contact the mail order vendor to trigger them to send your refill to you. That would be an automatic process for you. I mentioned early on the additional enhancements that are included in the program that are not part of, that are not necessarily a medical benefit, but these are services that are now included in the program. These are benefits that you do not currently have today, and these are benefits that are not currently offered through traditional Medicare and the supplemental plan. The first one is the Healthy Pantry benefit. And this was set up to help members who have chronic illnesses manage their condition better through nutritional guidance. And the Healthy Pantry, I used a diabetic member as a good example for this. Managing diabetes is clearly tied to certain nutritional guidelines that you follow. So each month, members would be eligible for nutritional counseling telephonically with a nutritionist. And they'll also receive monthly home delivery of non-perishable pantry items. So in addition to the nutritional counseling, they'll get a pantry delivery that will help them manage their conditions through nutrition better. We also have the house call program, and this is geared towards high-risk members or members that have multiple chronic conditions. And the house call program is where we actually send a clinician to the member's home to do an evaluation. They'll review through all of your medications, do a health assessment, do a physical right there in the home. This is a voluntary program, so members who do not want to participate in the house call program do not have to. But this is a service that helps members really get the appropriate care. So quite often we'll find that a member might have multiple different conditions and they're not, for example, maybe they're a diabetic, they have a heart condition and a pulmonary condition, and we don't see the member seeing a pulmonary specialist. We'll help that member get in touch with a specialist, a pulmonary specialist, to make sure that they're seeing the appropriate doctors to help manage their conditions better. Medicare Home Lab Kits. Based on what we've all experienced through the impact of what COVID has had on us in regards to, in the very beginning, it was difficult to get out and see your providers directly. We put in place, tools that help make it easier for members to do some of these tests directly at home, to make sure that you're getting those preventive care screenings done, such as colon cancer screening, and urine tests to help monitor kidney functions, and specifically A1C1 to help monitor blood sugar for those members that are diabetic or are pre-diabetic. Touched upon earlier the additional benefits. This slide just summarizes some of the additional benefits that you have included in your program that are not included under traditional Medicare today. Silver Sneakers is the first one. That is a free gym membership, and all members can go on to silversneakers.com to find what fitness facilities participate in the program. And like I said, that's a free gym membership. And Silver Sneakers also has some virtual events that they host. So if you can't get to the gym, they also have virtual classes that they conduct via online or Facebook Live. Routine vision care. In addition to your routine eye exam, you'll also have included a $100 eyewear allowance, and that's every 2 years. Special offers is a discount program that we offer to members where you can get discounts on certain services and products. May it be, an eye vendor or a vitamin vendor. Jenny Craig participates in the special offers benefits, and you'll also receive a full listing of all of the vendors that participate in special offers when you receive your post-enrollment welcome kit. We talked about telehealth and the Life Health Online. Emergency care. This is a big question that comes up quite often. Do I have coverage if I'm traveling overseas? You have coverage worldwide for urgent and emergency care. So under traditional Medicare, they don't cover you outside the United States. Under the Medicare Advantage program, you will have emergency and urgent care anywhere in the world. We also include a nurse line, and this is available 24 hours a day, 7 days a week. So if you have a clinical question that you want to just ask a medical professional, maybe it's in the middle of the night, your doctor's office is not available, you can contact the nurse line to ask clinical questions 24 hours a day. Routine hearing care. This is also a benefit that is going to be added to the program. You'll have routine hearing exams covered, as well as a $500 allowance towards hearing aids, and that's every year. So $500 towards purchase of a hearing aid, repair, or batteries for hearing aids. You'll have access to additional resources on Anthem.com, and that once you become a member, you can register. Under the registration for the member portal, you can see your claims, you can request a duplicate identification card, and it also supplies services for reminders. So under the Anthem.com member portal, you'll be able to get reminders to have your annual flu shot done or wellness exams. So this tool will also remind you to have certain services done. And then there's also routine foot care. All members under the program, regardless of your diagnosis, have routine foot care covered. Traditional Medicare will only cover this if you have a diabetic diagnosis. Under the Medicare Advantage program, all members are entitled to 4 routine foot care visits per year, regardless of your diagnosis. I touched upon the 24-hour nurse line for you, so we'll continue on. Silver Sneakers program, this just goes into a little bit more detail As I said, it's a free gym membership for participating gyms that are Silver Sneakers facilities. But in addition to that, we also have the flex classes, which fall outside of your traditional gym setting. There's online workout sessions that they have. There's also an app. There's many different additional resources that Silver Sneakers does offer in addition to just the gym membership. This is a listing of some of the vendors that participate in the special offers. As I mentioned earlier, Jenny Craig. There are some eyeglass vendors and hearing aid vendors and vitamin vendors on here as well. And all of these vendors offer their services or products to Anthem members at a discounted rate. And the discounts vary anywhere between 25 to 40% off the regular retail price for their services and products. I touched upon the anthem.com resources, and this is where you're able to get a temporary ID card, view your claims, or find a doctor. So if you want to find a doctor that does participate in the Anthem Blue Cross Blue Shield network, you do have a Find a Doctor search tool on the Anthem website as well. Enrolling. Everyone should have received or will be receiving their pre-enrollment mailing from Anthem. And this is the enrollment guide that goes into very specific details about the program. And it includes the full benefit summary, as well as some additional information on some of the special enhancements to the program and how to access the benefits. Now, the enrollment is going to be automatic for all members of the Milford Board of Education. It's going to be an auto enrollment process. So we will automatically, or the Board of Education will automatically be enrolling you into the Anthem Medicare Advantage plan effective January 1st. So there's nothing that you need to do in regards to initiating your enrollment. That will be automatic. Now, in your pre-enrollment guide, you also received what's called an opt-out form. So if you choose not to, if you do not want to be in the Medicare Advantage program and drop your coverage through the Board of Education, you would fill out the opt-out form and send that in. Just to let everyone know that if you opt out of the program, you're opting out of the Board of Education program. And that is for members that have the medical and prescription drug benefit through the Board of Education. For those members that only have medical, the opt-out process is slightly different and your enrollment kit would look a little bit different. So just want to reiterate, for those that have the medical and prescription drug coverage or the medical and the major medical benefit through the Board of Education, it's going to be an automatic enrollment process. Once you are enrolled in the program, all members will get their identification card, their Anthem Medicare Advantage identification card in the month of December. So all members will have their new card in hand prior to the 1st of January. You will no longer need to show your red, white, and blue Medicare ID card to providers or hospitals. Everything will be rolled into the one single ID card. And this is a sample of what the identification card will look like. And this is the card that you'll show to both doctors and hospitals and pharmacies. Once you're enrolled, you'll receive your ID card, but you'll also receive your welcome kit. This is your welcome guide. And it goes into a little bit more detail in regards to how the program works and some of the additional benefits. It also talks about your mail order pharmacy benefit, as well as your special offers and all of the additional enhancements. So this is really a welcome guide that helps you see the overview of how the program works and some of the additional resources that are available to you. Once again, I want to emphasize the fact that you do have a team of first impressions customer service representatives that have been trained on the Milford Board of Ed program. So they're there to answer specific questions that you have. Anything that we don't address today, please, I stress to everyone, please give the first impressions number a call, and they'll be more than happy to look up providers for you or answer any specific questions that you have. Now, what I'll do is I'm going to open up the chat again to see, we have quite a few questions, so I just want to make sure that I can answer all of them that have come through. Okay, so we have okay, question about the true out-of-pocket under the TROOP under the prescription drug benefit. There's a true out-of-pocket noted on the prescription drug benefit of $6,500. Members will not have any type of coverage gap or what's called a donut hole under the plan that's mirroring the Blue Scripts plan that you have. So all members will just continue to pay their co-payments. So for most members, that true out-of-pocket of $6,550 really will not apply to members. Most members will never reach the $6,500 when they're just paying their co-payments. A comment came in for most of the YMCAs are in the program. That's under the Silver Sneakers benefit. So most YMCAs, in addition to some additional standalone gyms, do participate in the Silver Sneakers benefit. I stress everyone go on to the silversneakers.com website to search what facilities in your area participate in the plan. There are a number of Silver Sneakers programs, facilities and gyms that participate all throughout the state of Connecticut, as well as nationally. There's over 16,000 gyms that do participate in Silver Sneakers. And it's portable, so you can take that, you can access Silver Sneakers in any state. So if you happen to be in Connecticut for the summer and you go to Florida for the winter, you can access a Silver Sneakers facility in Florida or any other state that you happen to be visiting. Okay. Question, this is a really good question from a member. They're mentioning the network and that there's an understanding that there's 3 types of providers. Providers that participate in the Anthem network. So there's providers that also participate in Medicare and accept Medicare assignment. But then there's also providers that participate in Medicare but do not accept Medicare assignment. Under the Medicare Advantage program, those providers that do not accept Medicare assignment are able to bill up to 115% of the Medicare allowable rate. Under the Medicare Advantage program, those providers will be paid the 115%. So whether the doctor is participating in the Anthem network or just participating in Medicare and accepts assignment, or participates in Medicare and does not accept assignment, all of those providers will be covered and the member's cost share will be 0. So regardless of the provider status, whether it's in network or out of network, not accepting assignment, those providers will be covered and the member's cost share will still be 0. And this actually works the same way as it does today. So today, if a provider is Medicare but does not accept assignment, Medicare pays their portion of the program up to the Medicare allowable, and then the supplemental plan will pick up that additional excess billing charge of that 15%. So in this scenario, we would pay, the Anthem Medicare Advantage plan would pay that provider the same as they were being paid today under traditional Medicare and the supplemental plan. Okay, question came up. I've received payment coupons as I pay for my husband's insurance. Will I be receiving payment coupons? And it's my understanding that the process for premium payments through the Board of Education for those retirees that do contribute or have to pay a portion of the premium, that process will not change. So all retirees should have received information from Milford Board of Ed that lets them know what their new contribution will be. So the payment coupon process should remain the same. The only thing that will change is obviously the cost or the premium payment on that coupon. And in most cases, most members that are paying for the plan or paying a portion of the plan will see a reduction in their premiums. Who makes the decision or approve for payment for services that require authorization, Anthem or Medicare? Under the Medicare Advantage program, the prior authorization process is handled directly through the provider and Anthem. We follow Medicare guidelines and Medicare medical necessity requirements for those. So the prior authorization process is set on the Medicare standards. So the same standards that Medicare uses to make coverage determinations are the same guidelines that the Anthem Medicare Advantage program follows. I currently see a podiatrist every 60 days. And the book says I can go 4 times per year. Can I still go every other month? If you're currently seeing a podiatrist based on your diagnosis of diabetic neuropathy, you'll be able to see that podiatrist more than 4 times per year. So the 4 time per year routine foot care visit is for members that do not have diabetic neuropathy. But if you do have that diagnosis, those members need to go more frequently, and you'll be entitled to go as often as you need to. So if you're going every other month, you can continue to go every other month. You're not limited to the 4 times per year. Are there any changes to Part B reimbursement? There is no change to the Part B reimbursement. So the process that's in place today for you to have your Part B reimbursed from the Board of Ed will continue. So all members that are eligible for that Part B reimbursement will continue to get the Part B reimbursed as you do today. Okay, question came up is, what guarantee do we have that the federal government won't pull the plan at any time? The program, the Medicare Advantage programs are programs that are administered through private insurance companies that are contracted with the federal government. They've been in place for many, many years. I don't foresee that the federal government pulling these types of plan anytime soon. But if there was a scenario that something like that would happen, then you would still have coverage through the Board of Education and traditional Medicare, but that would be highly unlikely that these types of programs would cease to exist. Are there any changes to the dental coverage? I mentioned earlier that for those retirees that have dental benefits, those are not impacted by this change. So your dental benefit, if you have the dental coverage, will remain the same. It's not impacted by the Medicare Advantage change at all. Okay. Question came up, what are the key takeaways that retirees should know about these changes? The key takeaways are a few. Number one, we're rolling everything into one program. So all of your medical benefits and pharmacy benefits are rolled into one program. We follow Medicare guidelines. So all services that are covered under traditional Medicare and the supplement today will have to be covered under the Medicare Advantage program. As I said, we follow Medicare guidelines in regards to those services. There's additional benefits that are now included in the program. So the program is really covering everything that you have today plus additional services. So that's a key important message is everything that you have today will be covered under the Medicare Advantage program, but you also have additional benefits and services that will be covered under the new program that you do not have covered today. The program works differently than traditional Medicare and a supplement. I mentioned earlier that it's a healthcare delivery system. It's not simply a payer of claims. The program is set up to help members really manage their chronic conditions better and help members navigate the healthcare system to make sure that they're getting the appropriate care. And in some cases, we may see a member who has multiple different conditions, and we're not seeing that member is, seeing providers. We may do outreach to that member to make sure, that they're seeing the appropriate doctors and that we're helping them, like I said, navigate the healthcare system. Okay. Question came up from the 90-day supply under the pharmacy benefit. Is there a better deal to go through mail order, or can you go to your local pharmacy? Under the program, you can get your 90-day supply at the local retail pharmacy, or you can use mail order. The cost for the 90-day supply will be the same, whether you go to the retail pharmacy or use mail order. Some members like the convenience of mail order because it's just automatically delivered to their home and they don't have to worry about going to the pharmacy to pick up the prescription. But you as the retiree have the freedom to get your prescriptions directly at the retail pharmacy for 90 days if you choose to. And those prescriptions would just be the 2 co-payments for the 90-day supply. Question came up in regards to the prescription drug benefit and the donut hole. For those retirees that have the Blue Script program today through the Board of Education, the Medicare Advantage prescription benefit is a full gap plan. So there is no donut hole under the prescription benefit for those members that had the Blue Script program. Follow-up question, is there a discount for getting a 90-day supply through mail order? There's not a discount there's no difference in regards to the cost, whether you get the retail through mail order or the retail pharmacy. So the 90-day supply will still be just the 2 co-payments for the 90-day supply, whether it's through retail or mail order. Question came up, do I need to get a prior authorization or approval to have my mammography done? No, that's a routine screening. You can just go for your mammography as you do today. You do not need prior authorization to have a mammography done. What is our maximum out of pocket for Part B and Part D drugs if remain versus, okay. The Part B drugs are prescription drugs that fall under the medical portion of the program. So if it's a Part B drug, an example of a Part B drug is a chemotherapy drug those Part B as in boy drugs are covered under the medical plan, and they would be subject to the zero copayment. So there is no maximum out of pocket for Part B drugs. If it's a Part D drug, D as in dog, that would fall under your prescription drug benefit, and you would just pay the appropriate copay depending on what tier the drug would fall under. So if it's a generic drug, you would pay your $10, or preferred brand name, it would be the $25, and non-preferred, it would be the $40. The mail order vendor for prescription drugs is CVS, is the mail order vendor for the pharmacy benefit. Question came up, my premium under the new program will be less than 50% of the current premium. How is this possible? The program is partially funded by the federal government. So because the federal government is contributing towards the cost of the program, that helps bring down the premium. So that's how the premium is reduced by so much. We currently have reimbursement procedure at the end of the year for Part B. How does this change? Your Part B reimbursement process that's in place will not be changing. So the process that's in place for you to get your Part B reimbursement will continue. So there's no change to that. Is there anything that will have a cost that we don't now? Under the Medicare Advantage program, this is not a off-the-shelf Medicare Advantage program. It was specifically designed for Milford Board of Education to mirror the benefits that are in place today, to provide members with coverage for all services, all medical services and hospital services at a zero cost share. So under the program, there are no services that you would have a copayment for your medical and hospital benefits. It would remain at the zero cost share. Are we getting a new dental card, and how does dental work? The dental benefit is not impacted by this change. So those benefits will just remain intact as they are today, and there'll be no change in the dental benefit. The dental coverage is outside of this program and is not impacted by this change. Okay, and some of these were answered. Okay, a question came up. Please review the 3 types of accepting Medicare providers. Just to be clear, okay, there's different types of providers that participate with Medicare. You have the 3 types of providers that members will have access to. The first provider is a provider that is a Medicare provider and also participates in the Anthem Blue Cross Blue Shield network. Those providers are in-network providers in the Anthem network, and those providers will be covered at the zero copayment. The next level of provider is an out-of-network provider, but participates with Medicare and accepts Medicare assignment. So that provider will bill Anthem, and Anthem will pay that provider 100% of the Medicare allowable rate, and that provider will accept the 100% of Medicare allowable as payment in full, and the member's cost share is zero. The third type of provider is a Medicare provider that participates in Medicare but does not accept assignment. That particular provider can bill 115% of the Medicare allowable amount, and that's the federal maximum billing amount. And that provider will bill Anthem the 115% of the Medicare allowable rate for that service, and Anthem will pay that provider 115% of the Medicare maximum billing amount, and the member's cost share will be zero. So regardless of the provider status, whether they're an in-network Anthem provider, out-of-network Medicare accepting assignment, or out-of-network Medicare not accepting assignment, all of those providers will be paid and the member's cost share will be zero. Okay, I do want to touch upon a question came up. There are some members or spouses of retirees that are covered under the Board of Education program that have to contribute towards the cost of the program that do not currently have any prescription drug coverage through the Board of Education. So under the new program, for those retirees or spouses that do not have prescription drug benefits today, the new program will include prescription drug benefits, but that program is slightly different. So you should refer to the benefit summary in your pre-enrollment guide that outlines the new prescription drug benefit that's included in the plan. So this program will be a combined Medicare Advantage with Part D. So for those retirees that are purchasing a Part D plan on their own, you no longer need to do that. That would be included under the new program, and the cost for that program for those retirees that will have the additional pharmacy added is the $166.85 for the additional pharmacy rider for retirees that don't have it today. So I just want to be very clear. The question that I just addressed only applies to a limited number of retirees or spouses of retirees under the Board of Ed that did not have prescription drug coverage in the past. Will I continue to receive a bill for Medicare? Typically, your Medicare Part B premium is typically taken directly out of your Social Security check each month. If you do not have it coming out of your Social Security check each month and you receive a bill from Medicare for that Part B premium, you will continue to receive that and continue to pay Medicare directly. Does this change affect all Milford Board of Education retirees? And the answer is yes. This change is applying to all Board of Ed retirees. Okay, a question came up in regards to helping navigate the system. And if we are, I guess, gatekeeping you and not allowing you to see a specialist, you have the retirees have the freedom as the member to see specialists as you want to. In regards to helping members navigate the system, this is really to aid members. So it's not to dictate to members that they need to see one specialist or another. You as the retiree and the member have the freedom to see specialists or not see specialists. We're really here and the clinicians are here to help guide members that may need help. Some members may not need the assistance or guidance. So we're not the plan's not gatekeeping. We're helping those members who need the help to navigate the system. Okay, the question is, as a spouse of a retiree, I have a Part D plan other than Blue Scripts. Do I get the drug portion of this, or can I save money by continuing my current drug program? This is a question we probably want to pose. We can take this offline and pose it directly to the Board of Education. In some cases, if you want to continue what you were doing because you don't have your drug coverage, you can do that. or you may find that the new combined benefit is a better program for you. Do I need a new prescription from a doctor to get a 90-day supply? If you have prescriptions at the local retail pharmacy today, you can continue to fill those as you do. Those prescriptions will still be good once the plan goes into effect in January. But if you want to get a 90-day supply, you just need to let the pharmacy know that you're filling it for the 90-day supply. I think you probably would need a new prescription from your provider, noting that it's a 90-day supply for that prescription. Okay. What about doctors out of state? Okay. Will doctors out of state accept the Advantage program? The program is a national program. So the providers that participate in this benefit are providers that participate in all of the Blue Cross Blue Shield programs nationwide. So they're all Blue Cross Blue Shield providers, but if they don't happen to participate in the local Blue Cross Blue Shield plan, members still have access to see those providers on the out-of-network basis. Those providers just need to bill Anthem Blue Cross Blue Shield for those services. Okay. I'm seeing some of these were answered. I just want to make sure that I get to as many questions as possible. What if the bill is more than 115% for non-participating providers? Under federal Medicare billing laws, providers that are recognized by Medicare cannot charge more than 115%. So they are prohibited under federal law to balance bill members and anything in excess of that 115%. So you will not see a claim come in or a provider bill for more than 115%, and providers are not legally allowed to bill members above that 115% if they do not accept assignment. Are any Milford retirees being allowed to remain on Plan F? The Plan F Medicare Supplement Program is no longer going to be offered as of January 1st. So the Medicare Advantage program that we put in place to mirror the benefits will be the plan that's available and the plan that'll be offered through the Milford Board of Education. So Plan F will no longer be available for January. Okay, I think that was the last question. Okay, a question came up specifically, do the retired principals currently on the Medigap plan have to change to Medicare Advantage? This new program, the Medicare Advantage program, is for all participants of the Milford Board of Education. So that would include retired principals as well. The Medicare supplement plan will no longer be offered effective January 1st. For those that are on Plan F, can they keep it? The Plan F benefit through the Board of Education will not be offered to Board of Ed retirees as of January 1st. The new program, the Anthem Medicare Advantage plan with the zero cost shares, is the program that is being offered through the Milford Board of Education. So Plan F will not be available as of January 1st. Retirees on the Century Preferred. If I believe those retirees fall outside of this plan change because they may not have full Medicare A benefits. So for those retirees that are under the Century Preferred because they're not eligible for Medicare Part A, those retirees stay on that current Century Preferred plan. Is all blood work ordered by a doctor covered? Yes. So if it's ordered by a doctor and it's blood work that's a Medicare covered blood work, it's covered under the program, yes. Is the question and answer portion of the session being recorded? I believe the entire presentation is being recorded and can be viewed for playback. In regards to the continuation for the Plan F, Milford is discontinuing the Plan F benefit under the Board of Education. So that program is not being offered. That's being discontinued by the Board of Ed. Okay. Thank you very much, Beth. I appreciate it. My goal is to try to be, I guess, address as many questions as I possibly can, make you feel a little bit more comfortable. We will be holding another Zoom session on Thursday, I believe. So if you want to attend another presentation, we'll be doing that again on Thursday for Board of Ed retirees. We'll also have the First Impressions line open, so please feel free to give the First Impressions line a call to ask additional specific questions that you have that may not have been addressed here. Great. A lot of good comments. Thank you very much. I appreciate it. In the world of virtual, it's difficult to try to navigate, answer everyone's questions, which I'm trying to do my best, and give everyone all the information that you need. And a question did come up as to, why we were using the chat function rather than having it open. What I can tell you is we have a large number of participants on the Zoom meeting. And what we found is it would be very difficult to be able to navigate everyone verbally asking questions because everyone would be talking. It's difficult to manage. So we thought that the chat function would be the easiest way to be able to clearly and concisely, address all of the questions. And by all means, if there are additional questions that you want to have personally addressed, please, reach out to the Board of Ed. They'll be more than happy to forward those over to me, and I'll be more than happy to give you a call back or address those directly. Okay, I think I've gotten all of the questions, and most of the comments have stopped coming in or have died down. I just want to turn it over to any of the other panelists who want to to make any comments or address anything in the chat?
Kim, this is Tom. I'll just say thank you for putting this presentation together. I urge people to use the first impressions line to ask their specific questions. Everybody's needs and healthcare issues are different, so this will impact each and every one of you in different ways. So please use the first impressions line to talk to them about your specific situations. The benefits have been outlined and clearly explained in comparisons that were provided, the side-by-side analysis showing the benefits. So again, everybody's situation is different. Not everybody is going to have the same scenario. So please, we implore you to use that information. It is available now. The meetings were recorded and you can go back and review at your leisure. So please feel free to reach out to First Impressions to get your questions answered. Thank you.
Thank you, Tom. I appreciate it. Okay, I think there are people that are dropping off. So at this point, just to reiterate what Tom had said, please reach out to the First Impressions line to have additional questions addressed. And I will get you the First Impressions number. Okay. The First Impressions number is included in your pre-enrollment guide or in the Milford Board of Education letter. And that First Impressions number is 833-848-8729.
I think we're good at this point, Kim.
All right, great. Well, I appreciate everyone attending. Once again, we'll be holding an additional meeting. And if there's specific personal questions, First Impressions should be able to address them, or I'll have the Board of Ed forward any specific questions that come their way, and I'll be more than happy to address them. Thank you, everyone. Have a great day.